Assalamualaikum and good day to everyone. Today in this video we're going to talk about COVID-19 and COVID-19 variations. COVID-19 is not a new concept in this day and age, but let me explain it shortly. The virus linked to the epidemic in Wuhan, China has been named Severe Acute Respiratory Syndrome Coronavirus 2, also known as SARS-CoV-2. However, have you heard anything regarding COVID-19 variants? Surprisingly, we know little to nothing about the variation other than their names and kinds, which are Alpha, Beta, and Omicron. Let's start with Alpha, the initial version. The first well-publicized variety was Alpha. It made its debut in United Kingdom in November 2020. Because of the spike protein in Alpha, which was considered to make it more infectious, the Alpha lineage was anticipated to be 30% to 50% more contagious than the initial coronavirus. According to studies, the Alpha lineage was most likely to send sick person to the hospital and was more lethal than the original virus.
The second variant is Beta. Beta was identified in South Africa at the end of 2020 and started to spread to other countries as well. This variant was about 50% more contagious than the original coronavirus strain. Beta spread more easily and some vaccines may be less effective against it. It worries citizens with the expert also had been concerned about its several mutations and its potential to invade our human antibodies. Thank you.
The last variant is Omicron. Regarding Omicron and the other Omicron subvariant that have surfaced, there is a lot to learn. Omicron was discovered in South Africa and Botswana in late November 2021. Cases will spread and multiply in other nations. Omicron caused the number of daily cases to soar to over 1 million by December 2021. Early studies show that it spread more easily. One explanation was that the virus spike protein, which connects to human cells, had more than 30 alterations, many of which are thought to increase the likelihood of infection. Now that we are well informed about the well-known variants, let's talk about COVID-19 symptoms. The most common and quite scary due to how normal the symptoms are: fever, cough, tiredness, and loss of taste or smell. The less common symptoms are sore throat, headache, a rash on the skin, or discoloration of finger or toes. Lastly, the serious symptoms that need to take quick action are difficulty breathing or shortness of breath, loss of speech or mobility, confusion, and chest pain. If you are experiencing any of these symptoms, please do some sort of action to confirm if you are affected or not. Stay alert.
The last topic that we are touching on is how to overcome the COVID-19 after being affected. Firstly, call your healthcare provider or COVID-19 hotline to find out when to get a test COVID-19. Next, maintain 1 meter minimum separation from everyone, even your family members. If or when you need to seek a medical attention, protect others by donning a medical mask. Other than that, always keep your hand washed, keep the space adequately ventilated, and for 14 days, about 2 weeks. Also keep an eye out of sign or symptom. Lastly, stay upbeat by exercising at home and staying in touch with your friend, family by phone or internet. That's all about our group story. Thank you.